Good morning. Today we are looking at exercise prescription. So exercise prescription in physiotherapy. So it is supposed to be known that before you prescribe the exercises that to your patient, to your client, or to whoever that it is, you need to take care of certain things before you give them, before you prescribe to them the exercises that you would want them to do. Okay, so this, all right, thank you. So basically, we're just showing what this setup would be. So we'll be looking at exercise prescription from the point of the hospital, from the point where, which is open, uh, where you are going to have people with different needs approaching you for exercise. So it will be a multi kind of exercise arrangement that we'll be talking about where you have multi purpose clients, those that need exercise for fitness, those that need exercise because their health demands so, and like that. Okay, so physical activity prescription is an underutilized tool for improving community health. So it is noted that this is a tool that can be utilized for us to achieve important important outcomes or desired outcomes in regards to exercising. So, in the right dose, physical activity can help to prevent, treat, and manage a range of chronic health conditions that increasingly impact the quality of life and physical function of an individual. So, meaning it has to be done in a right way with the correct dose. Safe and effective exercise prescription requires careful consideration for the target individual's healthy status, baseline fitness, goals and preferences. Health status, at what point in terms of health is your client? You know, clients or patients will be at different levels. Others will be at a level where they can manage to do an exercise for 10 minutes. Others, even 1 minute will be a lot of time. So that is what you will need to assess before you start. So you have to take note of their baseline fitness, the goals and preferences. What are their goals? What do they want to achieve? Others will be coming to you to say they want to lose weight. Others, they want just to maintain fitness. And what do they prefer? Do they prefer running? Do they prefer swimming? Do they prefer walking? So, meaning your prescription has to be tailored in those preferences and in the goals of your client. As I earlier mentioned to say, our discussion will be looking at we'll be looking at all angles in which our clients would want this to be, depending on where you are and what you want. If you are looking at the people that are whose health is who are doing it for health reasons, like who are down and they need exercise as part of treatment, as well as those that are doing it as part of keeping fitness, all those is what we shall be discussing. So it will be a broad kind of discussion. It is therefore important for physiotherapists to be equipped with guidelines for how to screen, assess, and when appropriate, prescribe exercise for benefit of their patients. You do pre-exercise treating in which before starting a physical activity program, the American College of Sports Medicine, which is ACSM, and the American Heart Association recommend screening to identify cardiovascular risk factors. You have to do pre-screening so that you know exactly at which point your patient is. These help mitigate the risk for adverse responses to exercise, as even moderate physical activity can trigger cardiac events in individuals who are largely sedentary. So you need to screen before you engage in these activities. So with this in mind, Two instruments are recommended to facilitate the risk screening process for fitness professionals. The most commonly used questionnaire is the PARQ, followed by the Fitness Facility Pre-Participation Screening Questionnaire. The PARQ is a brief seven-item questionnaire that uses a yes or no answer format to identify personal risk factors. In comparison, the fitness facility pre-participation screening questionnaire is slightly longer and captures more detailed information about cardiovascular symptoms. So this is the PRIQ questionnaire, which has seven questions, and they are just yes or no. So like one of the questions here goes like, do you feel pain in your chest when you do physical activity? So the patient just answers yes or no. Do you lose balance because of dizziness, or do you ever lose consciousness? Yes or no. So this is going to give you a picture of the level at which your patient is. Okay. It will give you a picture so that at the end of the day, you are able to classify them in which to put them in a category which they deserve, so that to prescribe the exercise that are fit for their fitness. The other one, which is this, the other one is longer. Okay, it's longer than the first one. It takes into account almost all the other details. Like we can see from here, it takes into account the history. Have you had, in your history, have you had a heart attack, surgery, and all this heart failure? So the patient will be answering on each of the conditions that are put. Have you experienced symptoms of chest discomfort on exertion? Do you experience dizziness or fainting or blackouts? And it goes like that. Okay? It goes like that. Cardiovascular risk factors. Are you a man older than 45? Are you a woman older than 55? And it takes into account all those. Your blood pressure, is it above 140, over 90 millimeters of mercury? Has it been like that? So the patient responds to each one of these questions, and this one is kind of detailed so that you get more information that you need. After this screening, the results will help you in stratifying prospective participants into any of the three risk levels, which are number one, low risk, moderate risk, and high risk. The low risk individuals are men younger than 45 and women younger than 55 with no more than one cardiovascular risk. Remember the last questionnaire, which is the pre-participation facility questionnaire, was actually detailed and was showing each one of these. So low risk individuals are young men younger than 45 and younger women younger than 55 with no more than one cardiovascular risk factor. So meaning if you are using the other PRIQ questionnaire, there it will be easy. Still, you will get this information from your area interaction with the patient during your subjective examination. As you are getting the examination, you will have this information still. So you will know that if this patient has at least no more than one cardiovascular risk, they fit in the low risk individual category. Moderate risk stratification pertains to men over 45 and women over 55 with two or more risk factors. The highest risk category includes any individual with non-cardiovascular cardiovascular, pulmonary, or metabolic disease, or who demonstrate signs or symptoms of cardiovascular risk. So all these, you will find them or they will come out when you are doing the pre-screening. Signs and symptoms of these conditions include pain, discomfort in the chest, shortness in breath, dizziness, ankle edema, intermittent claudication, and all those things that would come with such kind of condition and which will be taught about. This From this information, a decision about the need for medical clearance consultation can be made prior to further testing. And below is a summary of the medical clearance and testing recommendation based on the risk level of the individual and the intensity of exercises in which he or she wishes to participate. Okay. So here we have the risk category. Here we have either there is need for clearance or not, and we have the type of exercise conditions. Okay, so those individuals that you find that they are in low risk stratification and can do vigorous exercises, they do not need any clearance, and they can do submaximal to maximal testing without any emergency procedures in place and without anything to worry about. So those can freely do the activities. Moderate risk individuals will do moderate exercises, okay? Moderate exercises. Medical clearance not necessary, but they can also do maximal and submaximal testing. Moderate risk individuals who can do vigorous exercises, it is recommended because they're moderate and they can do vigorous activities. It is recommended to have the medical to a medical clearance, and they should do it under supervision. High risk individuals and moderate to vigorous exercises, it is highly recommended that they are cleared and they are supervised during the activity. Okay, so you need to assess the exercise capacity. There are multiple protocols that are used to measure the baseline capacity. It is very important for you to measure the baseline capacity of your client so that it is easier for you to make either follow-ups, to improve on the exercises, to make adjustments, at least when you know where it is, where they were when you started in the first place. There are maximal and submaximal testing which are supposed to be put in place. Maximal testing is reserved for assessing the capacity of individuals who participate in vigorous exercises. These tests aim to assess an individual's peak exercise capacity, typically reaching a point of volitional exhaustion. So in this type of exercises, you will allow them. Remember, they are in low risk category, and they can participate in vigorous activities. So these ones, you want to get them to their maximum point of activity, to where they will get tired up to the point where they personally give up to say, okay, now I'm tired, I cannot take anymore. That is what you record. Remember, we are trying to get the baseline. So these ones, you encourage them to go beyond to go to the maximum. Okay, as opposed to submaximal testing, in which which is adequate for individuals who will only participate in moderate to low intensity exercises. Submaximal tests are designed to evaluate exercise capacity without pushing the participant to their limits. So these ones, you allow them to do them as as they can manage, according to what they can tolerate. Okay, so if it is a distance that you've given them, let's say a 6 minute walk test, you tell them to walk. You can even provide the stool for them. You provide the stations where, if they need to rest, allow them to rest. But yours is to keep record of what they are doing. So in the 6 minute walk test or 10 minute walk test, they can walk continuously for maybe 3 minutes. After 3 minutes, they want to rest for 1 minute. You just be recording what they are doing. Then at the end of the day, you will know that in the 10 minutes walk test, they exercised without rest for 10 minutes. I mean, for 2 minutes, they rested for 30 seconds. They continued after 30 seconds. They rested for You are trying to come up with a baseline so that at the end of the day, when the exercises start, you can follow through the baseline to see if your patient is improving or regressing. After that is done, then you go into prescribing these exercises. Okay, you will do that based on the five principles. Number one is type of exercises, duration, frequency, intensity, and the volume. Type refers to mode of exercise training with the main forms being aerobic. Okay, main forms being aerobic, which are endurance training, resistance, strength training, flexibility, and the balance training. So you will determine the type of exercises at that point that your client will be doing. Is it any of these? Okay. The length and number of exercise sessions performed within a given time frame are described by duration and the frequency respectively. Intensity is defined as the level of effort being exerted by the participant and can be measured in a variety of ways. So these are some of the considerations that you are going to do. Then you are going to classify the exercises. The classification of exercises as low, moderate, or vigorous intensity is determined by several factors as well. Okay, including, so the first one we are looking at the disease and the symptoms, the history. So you can also now do this in the testing to see in which category your patient is. Okay, then you classify the type of exercises or the type of category in which they are, including the energy expenditure required for activity, heart rate response, perceived exertion, and specific metabolic equivalence. So energy expenditure and metabolic equivalent tests. This is a standard unit used to estimate the amount of oxygen consumed during physical activity. So when you are following this, you will classify those with low intensity, those in low intensity, those that are going to do activities that burn less than 3 metabolic equivalents. So we know in our setting it's kind of difficult for us to even measure this and see exactly what was lost during this time, but at least we can bank on exercises that have to do with light walking, such as light walking, stretching exercises. Those ones, we can use them as a pointer, and those that will be can do that. Those that will classify in that category will be doing this type of exercises. Moderate intensity activities that burn about 3 to 6 metabolic equivalents is achieved in exercises such as brisk walking, recreational swimming, and those in that category. Vigorous intensity will burn at least higher than 6 metabolic equivalents, which include exercise such as running, swimming laps, and all those. So those we can classify them as those type of exercises. We can also classify them by heart rate response. The intensity of physical activity can be gauged by monitoring the heart rate during exercises. Minimal increase in heart rate, participants can easily talk and sing. So those in low risk, you have already classified them there by the type of exercises you are going to choose for them. For the low risk group, you will choose from here as in which one fits them. Okay. Minimal increase in heart rate and participants can easily talk and walk. So you give them the type of exercises that are not as strenuous, but even as they are doing the exercises, they can manage to hold a conversation as well as singing. That is in low intensity exercises if you are following the heart rate response. Also, moderate intensity, noticeable increase in heart rate. Participants can talk but not sing. Those type of exercises where participants can talk but not sing. So the first one, when a person is walking, they are walking, they are in a walk, they can manage to talk and sing. But when they are doing brisk walking, it is difficult to sustain a breath in singing, but at least a conversation can be held where they can converse with the other. Vigorous intensity exercise, significant increase in heart rate. Participants find it difficult to hold a conversation without pausing for breath. So that is how we classify those activities and know that if a person is managing to do within those rates, they are either those in low intensity, you choose the exercises that are within those limits. At least those are guiding principles which you can use even when you do not have the scale, but at least you should be able to tell to say these exercises somebody can hold a conversation or not, they can sing and do other those kind of arrangements. Perceived exertion can also be used using the Borg rating of perceived exertion scale, often used to assess how hard an individual feels as they are waking. Okay, so low intensity using that scale, low intensity will be rated between 1 to 3 on the scale of 0 to 10, moderate intensity rated on 4 to 6, vigorous intensity rated on 7 to 10. Duration and type of activity. The classification can also depend on the type of activity and its duration. Often, low intensity includes tasks like leisure walking and household chores. So when you are looking for low intensity exercises, you look for this. If you remember, these are the ones that have also been cited in the previous classifications. So this stands as the baseline. This is what you are supposed to look at when you are trying to prescribe exercises for low intensity activities. They should be those that allow the patient that can allow the patients to converse, to hold a conversation, or which include exercises such as leisure walking. Moderate activities might involve brisk walking or cycling at a comfortable pace. Vigorous intensity, vigorous activity includes high intensity exercises such as running. So this is what we get from my table. That is just summarizing what we're from talking about. Okay, the low intensity, heart rate, and all those metabolic equivalent that we have been discussing. Okay, so you find that this is also a summary, okay, of how we can prescribe each one of these exercises and the guideline. It is recommended that each one of these exercises or a person is exercises for a minimum of 150 minutes in a week. Okay, so this is just like a guideline. If they are doing, you have already chosen at this point. If they are doing aerobic resistance, flexibility, or balance exercises, they can be doing them in this frequency. So this is it. Following that, the principles that we outlined can either be moderate intensity, 30 minutes, for you to get to 150 minutes per week. This can be vigorous walking, jogging, swimming. Okay, so these are people that can do those activities. And the table goes like that. The way in which this recommendation applied depends on multiple factors. In developing a program prescription, physiotherapist must consider the following. The first one, fitness level, the fitness goals, and exercise preferences. We highlighted this when we are starting. Equipment availability and other personal factors that may impact participation. You need to take into consideration all these. What do you have around? You cannot fail to come up with a suitable exercise program for a patient because there are no equipment or because they are not in a gym. You will have to work with what is around, what is available, and come up with these goals. What are their preferences? What type of exercises do they prefer? Do they prefer running to walking, or which one do they like? Otherwise, if you fit their program in what they like most, it will be easier for them to follow up. I mean, it will be easier for them to adhere to your prescription. Unlike when you force them into starting a new kind of exercise regime which they are not even interested in. So try to work within their interest and fit your program in there. Your aim is to have them exercise at least a minimum of 150 minutes per week, divided in whichever way that you can divide them. Okay, so this is just a reminder or a reminder on the principles that we've already discussed, where we are explaining a bit more about them. about the frequency, intensity, type, and the time. Okay. So you will need to progress after you have gotten the baseline. You will need to progress with your treatment. Progression is the way in which frequency, intensity, and duration of an exercise program are increased, and it is recommended for progressing aerobic exercise to increasing the duration of sessions 5 to 10 minutes every 1 to 2 weeks for the first 4 to 6 weeks. Okay, so as they are doing the exercise, slowly start increasing slowly, and at the end of the day, in case of resistance exercises, increasing repetitions is favored before increasing the load. So if they were lifting a 5 kg for maybe 2 weeks, it is important for you to increase the repetitions than increasing to 5 kg. So if they were lifting it 10 times, you increase to 15, you increase to 20, then now you go to 7.5. The increase should be calculated at least 5% of of the weight that they were lifting. Okay, so you calculate 5% of the weight that they were lifting. If it was 10 kg, you calculate 5% of 10 kg. That is what you add on their weight. Slowly, slowly, but even before you change the weight, you increase the repetitions from 5, going up, up, up. It gets somewhere around 20, then you know that they are getting used to that weight. Then you increase and start the same way with the other weight. Okay, implication for physiotherapy practice in this is that as experts in exercise across the lifespan of physical therapists physiotherapists stand to play an important role in promoting, prescribing, and managing exercise programs. A randomized controlled trial suggests home-based exercise and nutritional strategies have a positive outcome on the frailty score and physical performance in the pre-frail of real older adults. So these are some of the things which you can do. Actually, from just here, you have heard there is even a frailty score. You can embark on some activities and actually get some research. You can get some research topic from here and do that research. Check the score on your patients and bring something from there. Otherwise, exercise prescriptions should also be used to improve the fitness and well-being of patients and clients. So it is a very important tool that needs to be utilized in that manner. And once it is well utilized, you will find that it will actually give you the desired results, even in the predicted time as you got it from the assessment pre as well as the post. Thank you so much. We'll meet in the next meeting.